Definitely Connect has been a support for me, like just starting it off. I was able to kind of create my own support system by meeting people. I think that's a huge benefit of Connect, is that we're able to reach people where they're at, and we can understand them when they're away from their family members. And that's what a peer relationship is. You're at the same, very much at the same level. So it's not like, where you have a clinician and a patient, and it's you support one another.
So what Connect offers with this peer support program is social support. I have to emphasize that. Social support. It's not clinical support. The patients have a lot of clinical support in the hospital. The psychiatrists, psychologists, nurses, occupational therapists, social workers. So what we offer just complements that clinical support they already receive.
So one of our, something I'm really proud of is when people will approach me or approach someone in Connect, and they'll say, this program really helped me. I had never, ever met anybody with the same diagnosis. And it's just amazing. Like, that really touches me, because you think that, just from your own initial disclosure, that could help somebody else in the long run. And it's really powerful, because some people, their families don't understand, and so they really look forward to meeting with their peer.
Really important, because oftentimes, especially if you're isolating, you feel like you're the only person, and your disease may be telling you that you're the only one. So to meet with somebody else that can understand that, has been through that, and totally gets where you're coming from is really important. Yes, when I went in the hospital, I knew I'd been struggling probably for a year, and I knew I was, and I just kept pushing. Kept working. Like I said, I was a dog walker. Usually dogs make me happy, and I was walking dogs and crying at the same time. I suffer from depression and anxiety, and I tend to isolate, and having the obligation to meet somebody, especially somebody that you enjoy spending time with, gets me out of the house and sort of out of the rut that or the disease has sort of created for me, where I tend to be alone a lot.
And it's very strange, because Laura gives me, I don't know if you know this, but you give me so much. Yeah, you're really good for me. So I'm still not 100%. I'm much better than I was, and I can look at Laura, and she gives me validation also, and I feel like I'm moving forward, because I'm also making a commitment every week and making myself go out, just like you are. So I'm getting as much, I hope, as Laura is getting also.
When you're sick, say with depression, because that's what I have experience with, there's so much negative thought going with it, that you're not good enough, that nobody likes you, all kinds of horrible negative thoughts. And so it makes sense to isolate, because you don't think you're worth anything, you're worthless. And to have people, especially people who have a common background, that you can sort of have to force yourself, maybe in the beginning, to associate with. But I find after a while, sorry, I screwed up there.
It gets easier, yeah. After a while, it gets easier. Yes.
Yeah.
Because then you've been so used to hiding it, and now you're coming out with it and saying, this is me, and this is how I am, and please accept me.
Yeah.
And there's always the fear of rejection, even though you're with a peer, because it's a new experience for you. Mm-hmm. And when you realize that you are accepted just exactly how you are, it's amazing.
I remember aside from the peer support, there's also a sort of a peer meeting that we do, and I remember first time going to that, how scared I was. I took a buddy with me kind of thing, and we supported each other, and now I look forward to it, or I'm disappointed that it's not on this day. So it's really gotten me out of my shell a lot. It's been really beneficial. Before I wouldn't have gone out at all, really. Like, I really isolated. I didn't have anybody to socialize with, and now I was just saying My phone's just blowing up today with all these text messages. So it's like, what's going on? Why am I getting all these texts? And it's people from Connect. And we're meeting out in the public. There's a little sign on the table that says Connect for Mental Health. And we're just there being ourselves. And sometimes we refer to ourselves as the crazy table and laugh. Because, I mean, everybody's a little bit crazy, you know. So that's getting a face out to the public. And so if somebody comes up and asks, not that it's happened when I've been there, but somebody would address that, what's going on, and explain to them. So we're, you know, facing our issues as opposed to hiding away somewhere like it's a bad thing.
One, I remember telling me that, you know, it's just comforting to know that there's somebody out there who cares, and somebody you can turn to in a time of need. The peer supporters are there to be with their peers in good times and in bad.
That's how it started. Pretty much I had that vision that I wanted people to connect with one another and support one another, to promote mental health, and you know, just let them know that they're not the only ones. I really felt a calling to start the organization and to get things going. So, and I look forward to all the different avenues we might take in terms of programs and stuff, but it's always going to be, you know, driven by people who have been there, which is really important.